Good morning, and thank you very much everyone for joining. For those of you who do not know me, my name is Shamail Anwar, and I've been working as a consultant gynecologist in Maruf International Hospital for the past 5 years. So today I'm going to be talking about a topic which is intensely sensitive in nature. Domestic violence, although being declared as a serious public health issue by the World Health Organization as well as United Nations, is still a topic which is very less talked about. And one of the main reasons for that is that most of the medical professionals either feel uncomfortable or they are inadequately informed about how to deal with victims of domestic abuse. Now, according to one survey which was carried out in the year 2018 in England, more than 70% of the healthcare professionals lacked confidence in inquiring about domestic abuse from their patients. Research supports the fact that most of the victims of domestic abuse are women population, and we in obstetrics and gynecology see more women who are victims of abuse compared to any other healthcare professionals in other specialities. And so I therefore believe firmly that all the doctors in obstetrics and gynecology and the midwives should at least be experienced enough in recognizing the signs of domestic abuse in a woman, and should be confident enough in providing them with support and help. So a brief overview of what I'm going to be talking about today. I'll go through the prevalence rates of domestic violence across the world in different countries. I would also talk about some of the risk factors which increases the likelihood of victimization. We'll talk about the impact domestic abuse can have on women's health. I will also discuss some of the ways in which we can inquire about domestic violence, because it can be a little difficult for the clinicians as well. And how do we really offer assistance to victims? I'll also give you some important referrals that we have in place in Pakistan. And last but not the least, I would shed some light on the importance of incorporating education on domestic violence in the obstetrics and gynecology training curriculum. So what is domestic violence? The WHO defines it as any controlling, coercive, or threatening behavior, violence, or abuse, which could be psychological, physical, sexual, financial, emotional, between those aged 16 or over, who are or have been in intimate relationship or any of the family members, regardless of gender and sexuality. Now, if you look at the prevalence rate of domestic violence around the world, it varies from 5.4 to 27.7%. Now, domestic violence is something, unfortunately, which is not only present in the rural areas or in the developing countries, but it is very much there, and it exists in the developed societies as well. According to one survey which was carried out back in the year 1999 in Karachi, they reported that 34% of the women who were interviewed reported domestic abuse. Now, some 8 years later, in the year 2007, another survey was carried out in the same city, Karachi, and they estimated that 90% of the women experienced some form of domestic abuse. According to the Royal College of UK, 13 to 24% of the women receiving antenatal and postnatal care, and around 21% of those receiving gynecological services would report history of domestic abuse. And the CDC says that in the US, every 1 in 4 women would experience some form of intimate partner physical abuse. And it's 1 in 9 for the men in the US. So if we compare the prevalence rate of different countries, the lowest reported is in Japan, which is 5.4%. Now, it's worth mentioning here, and I think Dr. Mujtaba would agree with me, that domestic violence is a subject that we cannot, it's very difficult to research. Most of these prevalence rates, some of the prevalence rates come from different surveys which were carried out. They were one-time in-person interviews. And domestic violence is something which, the women may not want to disclose it to the clinical researchers or the clinicians in a first meeting. So we are not really sure whether these numbers truly depict the real prevalence rate that is there in these population groups. Now, during the COVID-19 pandemic, the United Nations Secretary General declared yet another public health crisis when the world saw a sudden surge in the cases of domestic violence. And this figure I've taken from the United Nations Women shows that there was a 30% increase in the the calls that they received on the helplines for victims of domestic violence in France. And similarly in Cyprus, Singapore, Argentina, UK, Canada, Germany, there were increased number of cases reporting domestic abuse. Now we do not have any data of this nature in Pakistan, but related to the COVID-19 lockdown and pandemic. But some of the mental health professionals who carried out some online consultations for victims of domestic abuse reported that they saw an increase in the number of cases in Pakistan. Now here's another figure which I've taken from a study published in the Pakistan Journal of Medical Sciences, which reported that 90% of the women in Pakistan have experienced some form of domestic violence at the hands of their husbands or families. And they've also given some percentages of the different forms of abuse that these women experience. Now, how many of you know where the phrase rule of thumb came from? Okay, so the history of domestic abuse goes back to some 200 years. In the year 1782, an English judge named Sir Francis Buller passed a rather infamous statement saying that husbands were legally allowed to physically abuse their wives, provided that the sticks that they used was smaller than the diameter of their thumb. This statement faced a lot of criticism, of course, and the judge was mockingly later on called Judge Thumb. And over here you can see in the cartoon he's carrying a bundle of sticks in his shoulders, and he claims to have found the cure for all the rusty wives who do not obey their husbands. Similarly, in our part of the world, in Pakistan, unfortunately, the Islamic teachings have been misconceived throughout time, and it's been confused with it has been confused with culture and social norms and traditions. And I'm sure most of you would remember that in the year 2016, an Islamic bill was proposed by the Council of Islamic Ideology, which said that men should be allowed to lightly beat their wives if they do not listen to them or obey them. This bill again faced a lot of criticism. There was a lot of outrage and it was slammed by the Human Rights Commission of Pakistan, calling it ridiculous. So we do have some laws in place in Pakistan against, for domestic violence. In the year 2012, there was a landmark bill which was unanimously passed in the Senate of Pakistan by the name of Domestic Violence Prevention and Protection Act in the year 2012, which officially declared violence against women and children a criminal offense which was liable to penalty. And by the way, in the West, not until the year 1994, domestic violence, wasn't outlawed, and for the UK it was 2004. So a few years later, in 2016, another bill was passed in the Punjab Assembly by the name of Punjab Protection of Women Against Violence, which proposed that they'd establish around 36 violence against women centers across Punjab, which would offer comprehensive justice delivery system to these women. Now, following are some of the risk factors of victimization. Violence again, domestic violence basically roots in gender inequality, which sadly persists throughout society. And therefore, women are more likely to experience domestic abuse if we compare it to men. The younger they are, the more prone they get. Women in the lower income brackets and those who lack education are less empowered. They do not know their rights and they are more vulnerable. Similarly, in the year 2018, according to the Maternal Morbidity and Mortality Report UK, they estimated that 30% of the cases of domestic violence either started or escalated in pregnancy, making pregnant women more vulnerable to domestic abuse. Similarly, women who suffer from long-term illnesses and disabilities are more likely to experience abuse. Now, here are some of the signs which should raise red flags for the clinicians. If they see them in a patient, in a woman, the women can have some physical signs. They present to the emergency department with unexplained bruises and injuries. And you see, typically these women try to wear oversized clothes and long sleeves, trying to hide the injuries that they've incurred. These women are, they show, symptoms of anxiety and depression, sometimes to the extent that they'll even have suicidal ideation. They're extremely apologetic. They'll have typically low self-esteem. You'll also notice that these women, usually they cancel their antenatal specialty appointments at the last minute. And some women in the West, they sometimes start to resort to abusing substance in order to cope with the problem or the situation. Now, it is recognized that pregnant women who suffer from domestic abuse are at increased risk of having adverse pregnancy outcomes. And according to one study, there was a 37% high risk of obstetric complication that warranted antenatal admissions. These women usually book late and they would request you to conceal their pregnancies from their husbands and their family. They'll come to the emergency department repeatedly with injuries and with unexplained bleeding in the early pregnancy. Going into preterm labor and having premature rupture of membranes is more common in these women. Unexplained stillbirth, intrauterine deaths. Now, we do not really know what the exact mechanism of this is, but some of the studies suggested that because of the increased level of fear and stress in the mother, sometimes there can be an increased level of fetal cortisol secretion in the baby, in the fetus, and that can trigger preterm labor in these women. And there was another study which suggested that, of course, because of the physical trauma, blunt trauma on the abdomen, it can cause minute placental hemorrhages, which can lead to the death of the fetus. There were again some studies which suggested that infections were more likely in these women, specifically renal tract infections. Perinatal depression, anxiety, post-traumatic stress disorder is more common. They gain less weight and they are more likely to develop anemia during pregnancy. In one study, which was published in the year 2008, they claimed that operative deliveries were more common in these mothers compared to the non-abused mothers. Now, the Confidential Inquiry into Maternal Deaths 2018, England, stated that women who were abused during pregnancy, there was a threefold increased risk of homicide in these women.
So they actually kill their husbands?
No, they're at risk.
Not suicide. This is homicide.
This is homicide, yes.
That means that they are the ones who may kill the husbands. That's what that means. Not suicide. Otherwise, they would have talked about suicide. This is homicide. This is important to tell the man in Pakistan.
Okay, so there can be some consequences on the fetus and child as well. According to one study published in the American Journal of Public Health, 2006, the relative risk of perinatal and neonatal mortality was 2.6 to 2.4% higher in these women. These women are less likely to breastfeed their children, and it is very important to know that children who live in households where their mothers are abused sometimes are themselves victims of domestic abuse, and studies have suggested that these children are more likely to develop mental health issues like anxiety and depression later on in life. Okay, so women who are abused domestically also suffer from reproductive coercion, and reproductive coercion, by definition, is any attempt by men to control their female partner's pregnancies and pregnancy outcomes. These women will usually be non-compliant to the contraceptive advice that you give them. They'll come with multiple unplanned pregnancies and would request repeated terminations. They present in the gynecology clinic with vague complaints. You know, they'll complain of lower abdominal pain, which usually do not have any explanation to it, bowel symptoms, which would not go away with any medications. So how do we really identify domestic violence? According to the WHO, it recommended that any person who works in the healthcare sector should be able to respond to violence against women and not just brush it under the carpet. They should ensure that women are not stigmatized or blamed if they do divulge in abuse. They should be given appropriate medical attention, and we should at all costs guarantee their security and confidentiality. Now, how do we really inquire about domestic abuse? Again, domestic violence is something which is is a subject which is very difficult to approach. Asking about domestic violence is not as simple as asking about a family history of hypertension from the woman. So there's no specific set of questions that would be suitable in all environments, and because we do not have any formal training in this subject, we need to practice certain questions which should not be judgmental. They should be at least in a way that the woman does not feel uncomfortable. It should be suitable in our settings. These consultations should ideally be carried out in a quiet and a private room, which unfortunately again is not the case in our in Pakistan, in our busy obstetric and gynecology clinics, but we should make an effort to do that. In the US, most of the medical organizations and the American College of Obstetricians and Gynecology also recommend that they should ask all the adult women about domestic violence. In UK, NHS and the RCOG also recommends routine inquiry about partner abuse, but this is only done in the maternity setups, not generally. And research also supports the fact that periodic inquiry helps in screening of women. According to 2 randomized controlled trials, one carried out in China and Hong Kong, and the other one was carried out in England, that claimed that routine screening of pregnant women coupled with referrals to the advocacy services would lead to reduction in violence and controlling behavior, and also in the reduction of number of cases would present you with injuries and depression. But of course, studies of this nature had some backlashes, some problems with it as well. The participants experienced some breaches in the confidentiality during this study. Now, how do we ask about domestic violence? This is the way how I do it in my clinic. So I start by telling them that because violence against women sadly is so common in our society, I ask all my women patients whether has anyone at home ever made them feel frightened or hurt them in any way. So in this one simple question, you'd screen the woman against physical as well as emotional abuse. But of course, everybody can have their own ways. Now, I've added 2 videos from the RCOG e-learning resource, which I found really useful. These videos contain a simulated antenatal clinic consultation. In the first video, the doctor tends to miss the cues by the woman about, the woman basically is a victim of domestic abuse, and he tends to carry on with the consultation with keeping his own agenda in mind. And in the second one, he lets the woman talk more and discuss her concerns, and eventually finds out that the woman is actually a victim.
She was then referred to the antenatal clinic after multiple attendances on the day of the obstetrics visit with abdominal pain and reduced feet movement. She usually attends the day unit with her partner, but has come to the clinic today for the first time on her own. We joined halfway through the consultation.
Your blood tests have been okay to fine. There's nothing in your urine or physical culture, DPP, heartbeat rate, and some of the height is increasing, and the growth scan is 5%. And baby sometimes we never quite make that call. Presumably it's called by muscle stretching. Exactly what's happening. We don't find things in the stick. But you might want to try some regular paracetamol.
You have to click on the screen.
Why don't we give that a go and come back and see us? It doesn't work.
Okay, so I think I'll just play the better version of the consultation.
She was being referred to the antenatal clinic after multiple tendencies on the day of obstetrics with abdominal pain and used fetal movement. She usually attends the day visits with her partner, but decided to visit today for the first time on her own. We joined halfway through the consultation.
Your blood test will be no case, right? There's nothing in your urine that's different. Culture, ETG can't be fundamental measure and showing that the baby can process. What do you think?
Can everybody hear it?
Figure out non-verbal things, but yeah.
Okay, so the main message here was that, we should be letting the woman talk more instead of just pushing our agenda. And by that, we can identify if the woman really has issues.
The woman patient, right?
Yes.
Okay.
We do not call pregnant ladies patients, so.
No, I said let the woman talk more.
Yeah, because that's what happens in our clinics. We tend to talk more than our patients really do. So there are some other ways of identifying domestic violence because some of the women, just may not disclose domestic abuse. In the UK, they have got these cost-effective and simple ways of doing it. They've got a red spot system in which they put this notice on the toilets, in which the toilets where the women are supposed to collect their urine samples, and those who are victims can place these red dots. They also supply them with the red dots there in the toilet, which they can put on the urine bottles and hand them over to the midwives. And in this way, the midwives can identify women who are victims of abuse, and they can offer them with the support without their families and the partner knowing. They've also got a credit card system in which they place small cards, which has important helpline numbers, which these women can, carry them in their bags and coats without their partners or husbands noticing. The other simple ways of displaying informational materials in the waiting rooms to serve as cues in order for to make the women know that the clinical settings are a safe place to talk about issues like domestic violence with their clinicians. Now, if the woman does admit to being abused at home, if the woman does not admit to being abused at home and you still suspect that she may be a victim, it's very important to document it in her medical records, because we know that medical record is a document which can be of help or aid the victim of abuse in the court of law later. It's a legal document. But it's very important to not to include this information in their hand maternity notes, because of course it will put the patient's safety at risk. Now, if the woman does admit to being abused at home, it's very important to ascertain whether she's safe to go home and to gauge the severity of violence that she's experiencing at home. And sometimes we can offer them admission in the hospital as a safety plan, but in our settings, most of the time that's not possible, because women, they are financially dependent on their husbands and they cannot just leave their children behind and just get admitted in the hospital. And options of escaping is not there for the women of our society especially. So in that case, the most we can do is to signpost them to the advisory services that we have in place in Pakistan. So like I said, sometimes the only intervention that we can do is to ensure that the information that they've shared would be kept confidential. We should acknowledge them and provide them with emotional support and make every effort to safeguard them. These are some of the safeguarding referrals that we have in place in Pakistan. Like I had mentioned before, in 2016, the government of Punjab started a toll-free helpline number, and they claim that they provide legal advice to these women. They help them with medical examination. They also provide post-trauma rehabilitation and sometimes help them with FIR lodging as well. But this is only for women who are in Punjab. And for the other provinces, the Ministry of Human Rights also has a toll-free number, which can be, given to these women. There are some private NGOs like Madadgar, Dastak Foundation, and Bedari, which also work for the cause. Now, if a woman is non-compliant to contraception, we should make all effort to recommend them using some long-term contraceptions rather than just asking them to go for the barrier methods or pills, which of course these women would not be able to take. And most of the time, the main reason why these women are non-compliant to contraception is because they cannot negotiate a plan with their husbands. Now, domestic violence, despite being we see a lot of cases these days of domestic violence. There's an increase in the number of cases of domestic violence in general, and despite the devastating effect that it has on mothers and children, we still in obstetrics and gynecology curriculum do not have any formal education on how to deal with women who are victims of domestic violence. Although NICE and the Society of Obstetricians and Gynecologists and also the Royal College of Obstetricians and Gynecologists, Australia and New Zealand, also recommends that it should be included. And so we're hoping that maybe in future, if it does happen, the clinicians and the doctors, especially working in obstetrics and gynecology, would be more aware and confident in dealing with such intense cases. Sometimes after consulting such women or dealing with such sensitive, intense cases, the doctors may suffer. They may have emotional exhaustion. So for that, it's very important that the doctors, the clinicians, should employ self-reflective practice. They should focus on the fact that they have provided the women with the opportunity to begin to discuss their situation with the clinician and to access services that may help them. Sometimes it can get a little frustrating too, because some of the women just do not refuse to access help. And in that case, of course, we just need to respect their autonomy and not try to impose ourselves on them. So here are some of the links to the important references that some of you might be interested in. So this cartoon I took from an article written by Professor Mushtaba Qadri on the patriarchal system that we have in Pakistan, and I would recommend you all to read. And in the end, I would so here's what our Prophet Muhammad had to say about how women should be treated by men in a Muslim society. The best of you are those who are the best to their women. Thank you very much, everybody, for your attention. Yes, Dr. Mustafa.
Absolutely relevant, very, very relevant. I just want to share some experiences. My wife is an examiner for the diploma that happens for general practice. And there were about 16 candidates only 3 weeks ago in Peshawar. And her station was domestic violence. Each and every single candidate failed it for the lack of soft skills and not having the knowledge where to refer them.
Yeah.
They were all referring them for carpal tunnel, nerve conduction studies, x-rays and whatnot because of wrist pain and not picking up on soft skills. Number two, increasingly in my clinic here, I'm having high frequency of these patients, increasingly. And picking these up and just listening to them is probably what they want. And most of the time they blame themselves. At least the experience that we have here. It's probably me. It's probably me. So I think this is very relevant. I think this needs to be repeated and shared as much as possible because this is very, very real.
Thank you. So,
what do you think is this? Does it vary from society to society? And is it related to education? Is it related to maybe certain habits, for instance?
It's not a class issue. It's not related to being educated or not educated. According to the little experience that I have in the clinics during my practice, I see women of all classes, educated, non-educated, who come to me, and I suspect that they are victims of domestic abuse. And like Dr. Mustafa said, most of them, they do really blame themselves.
I'm talking about something, for instance, there's a woman who's educated and a professional worker who has the ability to generate her own income. Is she safer than a woman who's actually dependent on the husband or whoever the partner is? Is that a risk factor or it won't be a risk factor?
Well, of course, being uneducated and like I said, if a woman is in the low income bracket, they are more, they do not know about their rights and they are,
My question was basically, why is it that there were certain figures that you placed it? Yeah. 57, 54 and 90% were two figures of Pakistan and 5.4% Japan and maybe 9% or something in UK or US. So what is the cause of that?
I do not know the exact cause, and like I said, domestic violence is a subject, it's very difficult to research on it. Yeah. Women may not want to disclose about it to the researchers especially. The evidence also suggests that एक meeting में most of the women would not want to disclose about domestic abuse because of the trust issues. It takes time. Even in my clinics, when women who are victims of abuse, they would not disclose it in the first meeting, but gradually when you develop a rapport with them, they disclose it to you, and sometimes, unfortunately, you cannot do anything about it.
At the time of Musharraf, there was a scheme in which the women were given the law, and the concept was that you give economic independence to the women. The rest of rights they can automatically have.
That's one.
And it helped a lot. They get the interview of the many people, the village women, who were saying now we are much better when we have got the economic independence. Because if you have economic independence, you know if that person is leaving me, I can take care of my children or myself. It makes a hell of a difference. Rather than you are thinking, just this person divorced me, or if he leaves me, where should I go? I should be going to my parents' home. There will be a brother and his wife. They will not be accepting me. We're going to protect my children. So I think the key to And obviously, it is not going to end the domestic violence if we have got the economic independence. But certainly, it will make the thing a lot better. At least you have a choice that if you can live with a person or not. I think the economic independence may be a key to stop it.
And that sounds good.
Yeah.
So,
कुछ comment here. Research का जो problem है इसका, I think was methodology. People are using the typical quantitative methodological approach to figure out what is happening. But you have to start thinking out of box, not out of box, but at least instead of following conventional paradigm, focusing more on qualitative data or mixed methods probably will give you better idea what is happening. Instead of just sending surveys, which are take marks surveys. So after दो interviews तो है ना, only strong. एक subject strong आपको होता है दूसरा है open ended qualitative approach. You let the woman talk. You let the person talk who is going through something, either through focus groups or one-to-one interviews. You can have services where people can just talk to someone they don't even know, anonymous. Right? हम बहुत दफा यहाँ पर कहीं यूएस में रेडियो स्टेशन हुआ करते थे, पता नहीं सब कादरी को याद होगा, हम लोग अक्सर होती हूँ कभी आप गाड़ी ड्राइव कर रहे तो एक रेडियो स्टेशन पे आपको मिलता था जिसमें कि बिल्कुल ओपन एंडेड टॉक हो रही थी, anonymous person calling and an anonymous person listening. And also वो इतनी इंटेंस होती थी कि आप गाड़ी चलाते हो थोड़ी देर के लिए आप घबराए थे कि यार आई हैव टू स्टॉप एंड फिगर आउट व्हाट इज हैपनिंग. आपने शायद मूवीज में देखा होगा ऐसी इस तरह की. So methodological flaws there. That is why you have not been able to pick up the right problem. उसको अगर हम एड्रेस करें शायद हमें ज्यादा बेहतर पता चले कि वो क्या है और किस लेवल पे हो रहा है. दूसरा हारून की जो बात है कॉन्टेक्स्ट स्पेसिफिसिटी बहुत इंपॉर्टेंट है. Honestly speaking, you cannot just वो कहते हैं ना one size does not fit all. You cannot say कि जो definition WHO ने दी है वो all across the globe एक जैसी हो. It has to be. जैसे मुझे दर्द हो रहा है तो दर्द की डेफिनेशन मेरी है आपकी. इसी तरह someone who is going through domestic violence उसको डेफिनेशन डिफाइन करने में आप रिफाइन कर सकते हैं थ्रू वेरियस इनपुट्स कमिंग फ्रॉम रिसर्च. आपने फाइनेंशियल ये वो सारे पर्सपेक्टिव शायद बात बात सोचता हूँ ये डेफिनेशन भी किसी मर्दों ने बनाई होगी अब जिस तरीके से हमारी बनती तो उस डेफिनेशन को भी ग्राउंडेड होना चाहिए for that particular context. Definition has to come from the people who are going through the pain of domestic violence. And let them define what is domestic violence. So context specificity मेरे ख्याल में बहुत important है. हमारी अक्सर प्रॉब्लम चाहे वो hardcore scientific research में हो चाहे वो social science research में unfortunately वो वेब से आती हैं और हमारे पास अपना जो ग्राउंड हो मोबाइल का इस्तेमाल करना, apps का इस्तेमाल करना. For example, Maruf can have their own app which can just anonymous reporting of these kind of things. And then if we are linked with those health services, so we can anonymously just report them and they can contact us, we can find a mechanism. So it's just a question of in terms of helping these people or discharging our social responsibility भी हो सकता है और शायद हमारी research भी हो सकती है. ये जनरल काम है.
Again, thank you so much for brilliant reflective session, I would say, more than anything else. इसमें जो वो जो homicide का said, I take that back. I mean, like, yeah, homicide, women are more at risk of the homicidal attacks by their domestic partners as well. But then a lot of women are also being arrested more and more for retaliatory violence against men. So both are on the rise. So domestic, people in a domestic relationship, it seems from various reports, just kind of quickly that both at higher risk of abusing or knocking off the partner after years of abuse. I think that is it's a major issue. Whenever you do research on these kind of issues, unless you close the loop, that research does not really translate into the ilman nafin or beneficial knowledge that we're trying to seek. it's important if we conceive anything like that, we want to close the loop where we bring in the social scientists, the healthcare professionals, the community advocates, the representatives of civil society and legislation, along with obviously those who enforce law, the law enforcers. Once you do that, when the loop is closed, then people who are this kind of relationship will find a way out of it, will be empowered, and society will be empowered to deal with these kind of things. Because it's the lack of enforcement of laws and similar legislation that has come in, which leads to an ongoing perpetration. Once somebody knows that there's a limit, and you have to break that cycle. I think if one needs to go into this kind of thing, it has to be something where half-baked research now. We find out the causes and all those things, but we are not able to close the loop. So multidisciplinary, पूरी उस तरीके से theme has to be taken. If this is considered to be an epidemic in Pakistan, the way to do it would be to first, reinforce that documentation through good mixed methodology studies and forms of community-based participatory research. And once that is done, then one takes it to the next higher level and closes the loop. Because people have been working in the NGO sectors and all that. I remember the Dastak group, Yasna Maroom used to lead that. And about when I was a medical student, one of our friends, colleagues who is now a famous anthropologist in the US, he enticed us to work in a group that Dastak used to. So we were part of a play called Teen Orte. And that Teen Orte, my role was also to, I think, पीछे बैठ के कुछ music on करना था. लेकिन वो तो Yasmin Ismail Marhuma and other people, there were people who were at the forefront of stage dramas at that time. I still remember Akbar Subhani and other people who were there. It was such a powerful experience, just going through the rehearsals. It was, and the story of the three women in different contexts and of all this, and then how it impacted me in such a way that when I was supposed to, when the actual play came in, I could not even put the music on at the right time. So somebody had to come and tell me, yeah, because it was just too powerful and overwhelming. I think these are kind of things.
आजकल शायद आप लोगों ने मुझे YouTube पे कभी 10 मिनट शॉर्ट फिल्म देखी डॉक्यूमेंट्री, वो 10 मिनट में पूरा जिस्ट, that is so powerful in giving message. So I wish we can have one जो कि हम लॉन्च कर सकें YouTube पे on this one. और वो इतना powerful message, for example, whatever happened just few months ago in Lahore or about a woman who got raped, तो उसके ऊपर एक 10 मिनट की film क्या लें, documentary क्या लें.
It has been done just now.
Yeah.
Actually, somebody has already done that.
Yeah, okay.
I think Mahara Khan or somebody has done that already.
YouTube पे. So we can also have something very similar. दूसरा जो एक और बात है ना, आप जितने मल्टी लॉज बना ले, देखिए डोमेस्टिक वायलेंस का एक लॉ बन जाएगा, इम्प्लीमेंटेशन चला जाएगा किसी में किसी खाते में, वो वैसे ही जैसे चोरी का लॉ होगा या किसी और लॉ में या टैक्स चोरी का लॉ होगा, तो वो सब लॉज बनेंगे. The problem is reconstruction चाहिए हमारी social thought process. That is what is required. जो कि तरबियत से आती है, जो प्लानिंग से आती है, जो पेरेंट्स से आती है, जो टीचर से आती है, इंस्टीट्यूशन से आती है, सोसाइटी मिल करके अपना वैल्यू सेट करती है, उसको दोबारा रीस्ट्रक्चर करती है, और फिर हो सकता है ये वो काम है जो कि एक दिन में नहीं होता. ये वो काम है जो happens over a period of decades with actual and active planning. हम अनफॉर्चुनेटली हम छोटे छोटे कंपोनेंट्स को के काम करते रहते हैं, लेकिन जो रूट कॉज है उसको एड्रेस करना, तकरीबन हर प्रॉब्लम के साथ रूट कॉज वही है. यू नीड टू हैव रिकंस्ट्रक्शन ऑफ सोशल थॉट प्रोसेस, द होल तरबियत का जो फिनोमेना था उसको दोबारा उजागर करें, क्या वो पास से लेकर के आए. जैसे हमारे एक मेंटर कहा करते थे, यू हैव टू गो बैक टू गो फॉरवर्ड. तो कहीं ना कहीं से तो वो मॉडल्स लाने हैं ना, उसके बाद कैसे इंस्टिल करने हैं. तो सोसाइटी ऊपर चलेगी, लॉज भी अपनी जगह पर होंगे, फिर चीजें काम करेंगी.
Can I add something to that? If you go back and watch Hollywood, Bollywood, all sorts of movies about, 10 years ago, 15 years ago, you'd see the violence as a part of the movie. And now it's been removed. And there are certain things that are now being brought in to normalize certain things. I think it's something that you've absolutely put it right. Okay, when you're in preschool or when you're a little kid and you see your parents, how they treat each other. When you go to school, how the female teachers are being treated by the male teachers, or how the female staff is being dealt with, the female kids and the male kids, how they've been dealt with. It's just the entire society that has to play its role for this to consider them that this is an issue. There is a mindset that exists in Pakistan, and we all know that, unfortunately, that there's a superior complex, and there's a lot of things associated with that. I don't want to go into those details, but I think it's just the society that has to, the 10-minute short video ideas, these need to be floated everywhere, YouTube, and even if you put down articles and you call in women, for instance, present women, all our gynae patients, I relate it to our activity here. If we have, let's say, 2,000 patients, we call in 100 patients and we say, so there's a whole seminar on this. If there's any concerns that you have, let us address them for you, and we can, and then we start educating them along with their husbands. So that might create a change of what we can do. The important thing is, to be honest, a wonderful topic. I just think that we'll just walk out of it. This is how the world actually, we walk out of it, and it's just going to be over set of it, and we're going back to our
forget it.
We won't do anything. So the important thing is what we're actually going to do to address this concern as Maruf Hospital, as a team of people who are concerned about this. I think something, calling in the parents, calling in husband, wife, and just addressing these or educating them would be a good start. Something on these lines. I think we need to take initiatives. I will take the administrative, and you guys can take the clinical, and we can combine our efforts together to put up something that can create a difference.
I absolutely agree with you. Dr. Neeva, you had a question, I think.
Yeah, you raised your hand.
Yeah, actually, I thought I'll Shamail, this is really a good topic. I think it's a taboo in Pakistan actually to talk about these things, but it's good that you raised this. The main issue is it's not that the domestic abuse is not there, it's there, but how actually to bring the women out to talk about it. In the West, it's even, I think we think that they'll be very open about it, but it's very difficult. And from my own experience in emergency, because of the lack of time and things, we always look for certain signs to look for vulnerable patients. And it's even more difficult in Pakistan where you can't do that. So what are those subtle signs in your mind, which for me as a clinician where I have very little time to kind of see, can at this point do that?
Now, I cannot point my finger at one sign. It's just that you have a feeling. I did mention a few of the signs that you should be looking for in a woman, but just a main experience in the first time when I dealt with the case of domestic abuse. The first time she did not disclose it, but typical patient, she used to, एक पुरानी patient थी, but I suddenly started noticing कि उसकी behavior में changes आना शुरू हो गए. She would cancel her appointments at the last minute, and that's what rang the bell that maybe something is wrong somewhere. She showed signs of depression. She would talk less. There were थोड़ी सी behavior changes. Again, it's very important because this woman used to come to me before pregnancy as well. But pregnancy, she started showing signs. And then, थोड़ा सा जब मैंने probe किया, I got to know that there were problems at home, and she, actually was unfortunately being abused at home by her family members and by her husband. So.
One question, I'm sorry, I missed the whole talk, but regarding this thing with domestic.
So you're just allowed to give a comment.
But I'm giving a comment. I'm not.
Okay.
The thing is that, even if you identify, when they say that, they don't make an eye contact, the husband is sitting, the husband is overnight to the patient, all those things, Even if you identify as all this, then what? Unless you don't have a constitutional or law amendment in Pakistan.
We do. We do have some,
Yeah, I know that you want to talk about the laws and all that. But the things are not implemented over here.
Yes, that's true.
So
I agree with that.
You can make it worse. This is a vicious cycle, You can make things worse for them, So that's what I'm thinking. When I saw this topic of domestic violence,
and that is why we have to be very careful and as clinicians, We should not be putting the women further into trouble.
Thing too, In America, in USA, like in any Western country, even if the voices are raised in the house, the neighbor will say, and the police is right there, and they're gonna say that, let me check in, Right. And then they provide the whole thing. If the wife complains, there was a cardiologist that he had in Cleveland Clinic, When the wife complains, she has a mark. There is no question asked. The husband has to spend the night in the jail, Then they will take care of it. But right now, the husband has to go, Then they provide the woman all those things, social. These things are not
really,
even if the laws are there,
That's what Dr. Mubin also said.
And if you go and, if you pinpoint this thing, and if the woman is brave enough to bring up this thing, that is a vicious cycle that can make things more worse, So that was just kind of a next comment, So that's, I think it's a very cultural thing too, across in Saudi Arabia, and then in Saudi Arabia, in the Middle East, there is no, I don't think that they have domestic violence, any kind of a, even the wife cannot travel unless the husband says that, she's allowed to go.
But how do we really know that they do not have domestic violence?
There are no laws.
Okay, there are no laws. Okay, I'm sorry.
I lived there. My father was a kafir of my mother and everybody. My mom, she has to write the thing, that, and that is I'm talking about in 1992 when you were kids and growing up. How come, when your wife is going to Pakistan, who the hell are you guys that you're asking that whether it's allowed to go? So, I mean, it is very well practiced in, in the Western country, but it's a cultural thing, And then there are your ulemas also have certain things that, you can use a little bit of violence, in order to practice. So
let me make a comment on that, because remember one thing, the Quran obviously, comes in these 400 pages, and people memorize it. Both people who memorize and people who understand and people who reflect and people who then practice and people who then disseminate, there's a big gap in all of these steps. So the understanding of that particular verse has to be from a Sharia point of view. You can't say that verse is not there in the Quran. You don't have to be apologetic about whatever is there in the Quran. But that word has to be understood. In what context? And when you take the faqih and the Sharia rule of that, they talk about this, that, so you're talking about it, and a woman has been unfaithful or something like that, and you take her away from the bed and this and that. All those things are there in the Quran. And then if there's a problem, this is exactly what it means. Treat her lightly. And when you try and say that, we go there and beating the Quran, that is where the understanding is from. So in our country, there are people who can rattle off tons and tons of verses of the Quran, but the context specificity is not there. So we don't bother to read the tafsir behind it, the understanding, the faith, and all that, and we just look at the allegorical, the ones which are, which is kind of the superficial meaning. That is where you get misled. And I think just like reading medical literature, unless you can critique and analyze it. So our problem with our ulama in Pakistan is exactly the same. We have no critical thinking, and there's no way of saying, oh, let us look at that evidence in the context of the hadith and everything else, what it actually means. What it actually means to do your wudu. I mean, like it's not there in the Quran, but it's in the Sunnah. So all those things, that particular thing is classical example Council of Islamic Ideology is going to take one verse out of context, and say, "Yeah, Quran is for children."
In order to support your Islam, I'm not an alim or anything like that. I'm, nothing else. But what alim was saying is, they were giving it. They always say that, okay, you can marry one, you can marry two, you can marry three. They will read that, but they won't read afterwards. That if Allah Himself telling you have to be fair, and I am telling you that you are not going to be fair.
And only one.
Only one. Yeah. So that's they won't read about that part.
Yeah.
They will never talk about
that. So I mean, like it's just like reading half of the Quranic ayat.
Yeah.
Thank you very much.
Thank you
very much, everyone.